So as Gabby said, my name is Dr. Al-Khudari, and I'm an ophthalmologist here for about 23 years at Family Eye Physicians. And we have offices across Chicagoland. We have an office here in Oak Lawn, Orland Park, Chicago, Buffalo Grove, Schaumburg, and Oak Brook Terrace. That's our newest one. And I know people here have questions about cataract, so that's why everybody showed up. Make sure you got a lunch. We have a nice lunch here for you, and we thank all our sponsors for that. So what I want to talk to you guys about, some things that everybody's thinking about in the back of their mind. Cataracts and glaucoma. I know you're thinking about that. I remember like the first day of school, third grade. You remember how anxious you were to get those new notebooks from the teacher? Remember they'd hand those new books, those Mead notebooks, the red one and the green one. You'd be praying for the blue one. Remember those books with the binders? I used to love those things. Now my kids don't even get those books anymore. They don't even have that. So this is, I know you guys have been thinking, and everybody's anxious, and we're going to answer all your questions. We're going to make it easy for you to understand, okay? So we're going to talk about two things today, cataracts and glaucoma. And I know everybody might have said, oh, my grandma had glaucoma. My aunt had cataracts. My great-grandfather did this. You know, when you're a kid, when you're 5 years old, you remember all that talk happening around you, right? And you heard your grandma went there. So we're going to answer all those questions. And no question is a wrong question in my mind, okay? And don't be embarrassed to ask. So here we go. It's cataracts and glaucoma seminar. This little thing about me, some housekeeping thing. I'm a board-certified ophthalmologist. I went to the University of Illinois, fellowship in pediatric ophthalmology as well as adult ophthalmology, and I've received many awards for the Chicago Ophthalmology Society and different teaching institutions. So let's just start off with, make it simple. What is a cataract, okay? Who has a cell phone here? Anybody have a cell phone? Oh, sure. Okay, so the cell phone, imagine the camera where you take the picture, what happens? It gets dirty. And what happens when it gets dirty? You can't see. That's what happened here. That is what a cataract is. It gets foggy and you cannot see through it. And that is the whole problem. So everything we're talking about right now in cataracts is cleaning up the camera phone so you can see through it. That's all we're trying to do. And the good news is it doesn't happen when you're young usually. It usually happens when you're older. So you got to consider it a bonus that you got to reach this age so you get to see this cataract, right? It beats the alternative. So a cataract is when the normal clear lens in the camera gets dirty or cloudy. Now it could happen from trauma, very rare. It could happen from diabetes. And it could happen from the sun just getting older, okay? And the only way to get rid of the cataract is to take it out by a surgery. It's an outpatient surgery, a simple surgery, but that is the only way to take it out. So we take that lens out and we put a new lens in, and we'll sit and explain all that to you today, okay? Next slide. So age is the most common, causes blurry vision, becomes sensitive to light. Another thing that a lot of people complain about is when they're driving at night, they have glare. That's the number one question I always ask everybody. Do you have glare at night when you're driving? That's the cataract. And you have yellowish tint to your vision. Family history. If anything I've learned over life, you cannot run away from your genes. Let's be honest. You know, like sometimes your kids complain about you. You're just me. In 20 years, you're going to be like me, right? Being a little obese, lack of exercise, all the typical stuff. But see, an eye with a cataract is foggy. A healthy eye is clear. Now, sometimes people, they have cataracts in both eyes. What happens when you have cataracts in both eyes? But the problem is, it's so foggy in both eyes, you never realized it. And when you never realized it, you just think that's how the world is. Correct? Okay. So, first of all, the number one surgery in the world is cataract surgery. The most common surgical procedure in all adults in the United States. It's an outpatient surgery, takes about 15 minutes, and most people have no pain, and they have a quick, rapid recovery. And they don't have to go to the hospital. They don't have to stay in the hospital. They go in and come out. Not like the old days where they had to stay in the hospital 5 days. You remember those days?
Nope.
Okay, next slide. Okay. So, the first thing you want to ask yourself is, how do you take out your cataract?
That's what I want to know.
And there's only two ways to take it out. The laser way or the non-laser way. Okay? So I'm going to tell you the traditional way. It's a manual way where we make a small incision and we remove the cataract by a blade.
Okay.
And then the laser way, the laser creates a precise opening in the cornea. It's more accurate than by hand, and we suck out the cataract. So I always tell my patients, we go to the laser video, I always tell my patients, the first question you want to ask yourself is, how do you take the cataract out? Laser or no laser? And I'll show you this video several times, because this is the most important thing. This is the manual way to remove the cataract. So what's the first question you have to ask your doctor? How are you going to take it out? What are the two options?
Traditional.
Uh-huh.
And laser.
This is the traditional. This is the laser.
Right.
Which way do you think is better?
Laser.
Laser. Let me tell you why it's laser. It's more precise, less energy in the eye, safer for the eye, and it's smoother and quicker and easier. So let me describe it to you a simple way. Remember the old days when you drive? You guys are old enough to remember stick shift? Who remembers stick shift?
Never drove one.
I don't know how to do it,
I do.
but right, clutch, right? Remember the clutch? That's like the manual way. And the new way is
Automatic.
automatic. That's the difference. Probably in 10, 20 years, all cataract surgery will be laser. Insurance does not cover laser. However, it is one of the best investments that you will make. Next slide. So the laser used less energy to break up the cataract, less swelling in the eye, and it can heal faster. The laser makes a perfect circular opening. It's always the same size. Sometimes what I do is, this nice lady has a pen and paper, and can you draw 3 circles on here? And you can show it to the group.
Can you see it?
You can show it to the camera. It looks similar, but it's not the same, right?
Right.
But the laser is always the same. It never changes. The laser never has a bad day. Never drank too much coffee. You know what I'm saying? It's always the same. So that's why we really like laser. If your ophthalmologist suggested it for you, then you can have laser cataract surgery. Not everybody can have laser cataract surgery. But if you're a good candidate, he will tell you, or she will tell you. So the first question you got to ask yourself wherever you do your cataract surgery is, how are you going to take your cataract out? Laser or no laser? The second question you want to ask yourself is, what lens do I place in my eye? So I always like to talk about different things. First, people always ask, do I have to have a lens?
If you want to see.
You want to see, you got to have a lens. It's like having glasses with no lenses, right? You need a lens, okay? The second question is, there's options in lenses when your glasses, right?
Yeah.
Same thing, there's options in the lens that you can put in the eye. One option is a lens for far only. That's a traditional lens that cataract surgery has been done with. That lens won't help you see up close. Another option is a lens that helps you see far and near. A third option is a lens that helps you see far, intermediate, and near. And another fourth option is a lens that will be made custom tailored to your eye. Now I know I've thrown a lot at you, but you have to know your options. If you don't know your options, you always come back, oh, I wish I did this. I have patients all the time. I wish I came to you before. You could have done this. I said, it's too late now. Once you have that lens, that's it, okay? Go back to the video for a second. And I just want to show you in the video, and we'll come back here in a second. So this is the lens. So you can have a lens for far or a lens for far and near. But this is where the lens goes. So the lens goes in there. So there's different types of lenses. So there's one lens that helps you see far and near. So the way it works is it has different rings in it. And there's certain lenses that can help you for astigmatism. If there's one word that everybody remembers, it's the word astigmatism. Right? Am I right? You always remember that word because it just means that your eye is shaped like a football. It's not smooth. But everybody gets nervous when they hear that word. Astigmatism is something that we can take care of. Okay. So we have the good news here at Family Eye Physicians, we have all the lenses available to us. And that means we have different options and we can help you out with those different options. Next slide. Okay. So we talked about if your ophthalmologist says you're a candidate for laser cataract surgery, then that's good, then you can have that. People who have eye injuries or certain diseases, they don't get laser cataract surgery. So if your diabetes is not affecting your retina and it's doing good, you don't have to worry. Then here we're going to talk about the light adjustable lens. We're actually one of the first practices in Illinois to offer this light adjustable lens. So this is a lens that we can custom make for your eye. So imagine you're going to go to a wedding. What's your name?
Future.
Future. I like that. You're the future. That's a beautiful name.
Thank you.
You're going to a wedding. You want to get a dress. You can get a dress from Macy's, Walmart, or Seamstress. There's different.
With my dress.
Yes. So no, just like you. So that light adjustable lens is like getting a dress from a seamstress.
Made to your body.
Made to your body. And what happens when it's made to your body?
It's perfect.
But you have to go and do the fittings, right? Oh, a little more here, a little more there, that kind of stuff, right? That's the difference. And so it takes a little longer. But you know what they say, all good things take time. Yes. So just in case you want to do that, that's a light adjustable lens. And I want to show you, you just mute it though. I just want to show you so you can have a real video of how these videos work. So this is, this is you on your vacation in Hawaii, future. Okay. So this is what happens when you come and you talk to the doctor about the options that you have. So right here, this is the laser and this is the manual technique. That's like a good overview of that. And you see the difference? The laser is smoother, it's cleaner for you. The manual takes a little longer. This is the cataract that we're taking out. In essence, that's what we're doing. We're going in, we're taking that out, and we're putting a new lens in. And that's the IOL, that's the intraocular lens. That's the options of the lenses that we have to place.
So you might as well go big or go home.
Yes.
Get the custom.
If
You can't go back. You said
you really cannot go back. This is the manual way we go in, and this is opening the top of the lens. So the best way to think about this is like opening an M&M. The cataract is an M&M. We open the top of the M&M. We take the contents out, and we replace the contents with the lens. So this is breaking up the cataract. This is the manual technique, but we want you to see it so you know. Then we take out the pieces. I mean, even if you do a traditional, it's not a bad technique. We do have good results.
Okay.
So we take it out.
It's just less invasive.
Less invasive, less energy. No, it works. I mean, it works well. So then we take it out. And this is the laser that we like to use. And see how it makes a 3D image of your eye? And then we model your eye. And then we take the image and we place it into the laser. So we know exactly how it looks when we're breaking it up. Because we measure, we measure what you're going to have in there. We know, we have special instruments and tools that we measure.
Oh, okay.
So this is breaking it up with the laser. You see that? It's a whole bunch of small little pieces, and then we're suck it out. You see that, how it works? Taking out the pieces of the M&M, inside the M&M. That's all it is. And then we put the lens in there. It really depends. So look here, if this is the normal vision, that's astigmatism right there. So we like to reduce the astigmatism. We like to make your vision really good for far. And we can put the lens in there for far and near.
Oh, okay.
And at the same time, if you have glaucoma, we do a procedure called an Omni that will help lower the pressure in the eye. So the good news here is that we have about 14 doctors that work with us
Okay.
in the clinic. So you'll be seen by a team of people.
Oh, okay.
So it's not like just one doctor. It's a whole, like they say, it takes a whole village
Yes.
to raise a child.
Yes.
So we believe in teamwork here.
Okay.
So we've assembled a large team to take care of you, to help you see the best that you can. And we have offices across Chicago. So if you have your surgery here and you go stay with your daughter in Chicago or in Orland Park or in Buffalo Grove or in Schaumburg, you'll be seen.
Okay.
Okay? And any questions?
Or interfere with this other eye.
Sure. We usually like to do them separately, at least 1 to 1 month apart.
Okay.
If the other eye doesn't have a cataract, some patients, they want to wait. The thing is, it depends on the lens. The brain adjusts to it the best when you do them back to back,
Okay.
like a few weeks apart.
Yeah.
But it just depends on the person.
Okay. Okay.
So, if you get cataracts in both eyes and glaucoma in both eyes, you do one in 1 month and then do it the next month?
That's a fair way to do it. That's a fair way to do it.
That's the best way to do it, because when you do both of them, you can't see. You're right, that's right.
Yeah, because I began to see, I had the cataract
Yeah.
several times.
Who did you do it with?
This time I did it here with
Okay.
Dr. Chan.
Oh, okay, good. He's very good.
Dr. Chan, but he had to take the lens out.
Well, it might be because you had some cornea problems or some
Yeah,
other.
I had
If
cornea
yeah, you have some cornea problems. It's different. I mean, every it's-
But I do have a cataract and what is it, glaucoma in the other eye, but I won't let him touch it.
he'll tell you when you're ready, and you guys, it's a team effort. You got to decide together.
We can't touch this eye because I can't get no vision in this eye.
Sure. It depends. I mean, when you yes, yeah. Of course, you only have one good eye. You're nervous. You want to wait until you really yes.
Exactly.
You said that insurance don't cover the laser?
It does not cover the laser.
How much extra is it for the laser?
Your counselor will talk to you, but I know for a fact that our prices are some of the cheapest in Chicago for the laser, because we want the patients to be able to have the laser.
Yeah, I know quite a few that got it. They say it really works.
Well, very good.
It was real expensive.
No, and we have financing options. We will always take care of our patients and make sure that we can try to find a fix around to make it work for their budget.
Oh, yeah.
Okay.
Have to be
Now,
flexible.
I mean, that makes a lot of sense.
Yeah.
Because I know the insurance don't.
Yeah, we want to make it work for you guys. Okay, sure. Yeah, so pretty much you just make an appointment. Gabby can help you with that, and you come in and they'll take a look at her. We'll check her vision. She'll see me or one of the team of doctors that we have,
Okay.
and they'll check the vision. Make sure that she needs the surgery first of all. Make sure that everything in the back looks good, and it's appropriate for the surgery, and then they can set you up with the surgery.
So it doesn't matter which location she's at, because she just said that she's in part of your guys' practice.
Okay.
It's always a team.
Sure, yeah. Which office did you go to? Okay, good. Yeah, so we have Sandy, who's our surgical scheduler there, and we have Dr. Rao and Dr. Chan there. And you can always switch. And sometimes if you like one office versus the other, you can. Where do you guys live?
She lives in Country Club Hills.
Okay, go. Yeah, I mean, you might want to go to our Oak Brook office. There's different things. Or you just find, when you find the office that you're comfortable with, if you just talk to Gabby, she'll help set you up.
Okay.
Yeah, I went to Orland Park
Okay.
office and then I see who took the test.
Very good. Well, thank you guys. Oh, ask any more. I like questions. Let me tell you, I'm the guy at the end of school asking questions.
No, we went to the Oakwood office.
So, when you get ready to have the surgery, where do you have it at?
So it depends on your insurance, which surgery center you can have it at, and the team will help you. We have counselors who will help you with the whole process.
Oh, so the Medicare plan that I have would have to tell me or tell you.
Yes.
Or to let me know which
Yes.
one I would have
Yes.
to go to.
Yes.
And how much they gonna pay and how much you got.
Yeah, they know. The whole team will tell you.
Yeah.
Well, I mean,
Because you have to pay something out of your pocket, cause they gonna only cover so much,
I know
right?
that.
They
Yeah.
gonna only cover so much.
But I always thought when you do laser that you had to pay the whole thing right at once.
They have financing options. They have a lot of different things for you.
Oh, okay.
My insurance will only send me to little company.
We have doctors that go there. So we have.
They don't do laser over there.
They can't have laser. No. We have doctors that would go there. Though. We might have some new options for you too. Yeah. Sound good?
Good.
Just talk to Gabby. She'll help you.
I had a retina detachment,
Yeah.
and after it healed, and I get these injections every 3 months.
Yeah.
So I guess because of the injections that speeded up the cataract.
That's
or
true.
Whatever. So I see a retina specialist.
Sure.
So I just I'm always listening. So I heard him tell the person that's scribing for him that this eye was like at a 4. So do you know what those numbers mean?
It might be the nerve. It might be the nerve size.
Because I know he said this one was ready to me thinking about cataract surgery, and this one was like 3. It was like lower. So I guess this one is not as serious as.
That's probably true. That's correct.
So the retina side that it detached, that's probably spaced
Yes.
up.
Yes.
Yeah.
Yes.
Okay.
And the good news is that we have all the measurement tools in all the offices that are really precise to measure. Because especially when you had a cataract after retina surgery, there's different things that have changed, and we'll take care of that for you.
Okay.
Okay.
You guys gonna take care of everything. Huh?
Well, the good news is, I mean, we have all the resources. Thank God we have all the resources available to you, so we can handle that. I mean, I always ask everybody, just pretty much go and compare our offices to the other offices and the measurement. So you be the judge of it. You know what I'm saying? You be the judge. Okay.
They don't do it, they know that.
We want to help
And
you.
just think, I started not to
Yeah,
come to this,
because the last
but my
doctor
granddaughter
that I
works at
had
a place like this,
Okay.
and she was like, "Mama, you need to go.
Yeah,
you
my
need to
daughter
go
worked across
see."
the street.
Okay.
Oh, do she?
Yeah.
Yeah,
she
so
said,
she
"You gotta
said,
come."
you better go, cause it's very good. They explain everything. Cause see, I'm one that, okay, this is gonna cost too much. I'm all by myself. I don't have that much money coming in. So, and she was like, go and see.
We aim to please. Anything that you need, you can always reach out to us. You can always call the office. There's always somebody available. You can ask for me, Dr. Al-Khudari. You can ask for Gabby. She's always available. Pretty much what we do here is once you start your journey on cataract surgery, we assign you to a counselor.
Okay.
And that counselor is somebody that's going to help you. So remember how scared you were in first grade? Were you? What did the teacher say? Come over here, future. I'm going to take you on this journey. And then all of a sudden you finish first grade, second grade, third grade, 8th grade, high school, and it's all over now. And you wish you could go back.
And you took us on that journey today.
Which was very good.
Thank you. Thank you very much. Thank you, guys. Thanks.
Everyone.
Thank you
So
very much.
just to let you know, Jessica is one of our surgical coordinators here in our Oklahoma office. We also have Ruby here. She's back in our main office across the street taking care of Dr. Chan's patients. Out here in our optical area of Dr. Green, we have a representative from the light adjustable lens. So if you have any questions about that, Rachel's right over here. She can answer any questions for you. We have Katie from Rainier, who is one of our other lens options. If you want to talk to her and see, ask her any questions. And then we have Lou from Sight Sciences. He is our rep that helps with our glaucoma procedure. So if you have glaucoma or you have questions on how that procedure works out, stop and see Lou. He'll answer any of those questions. If you guys want to make an appointment, I'm available to schedule that for you. Jessica's available to schedule that for you. We'll be more than happy to bring you in so you can see Dr. Al-Khudari, Dr. Rao, Dr. Chan, and even Dr. Kaja. So any of our
I
doctors.
have an appointment with Dr. Chan.
Yes, he's very good. We also have Dr. Garcia here.
Oh, that's
Yeah. Oh yeah, she's very nice.
Yeah,
Very kind.
you just missed Dr. Garcia. She was here. She's one of our medical optometrists that helps with our post-op care. Like Dr. Al-Khudari said, we have a team that helps with post-op. So Dr. Garcia, Dr. Nunez are here. Dr. Mosin is in a couple of different offices. We've got Dr. Omar in
Orland.
Orland. We've got Dr. Pappas in Oak Brook. We've got Dr. Carroll in our Albany Park office, our Chicago office. And then Dr. Mosin also handles our Buffalo Grove office. So like Dr. Al-Khudari said, we have a team that's ready to take care of you. So,
Thank you.
Thank you.
Thanks everybody.
Thank you so much.
Thank you. Thank you.
All right, very much.
Thanks.